Barber surgeons were an important part of medical history, especially during the Middle Ages and early modern period. At a time when formal medical training was limited and often reserved for elite physicians, barber surgeons provide practical hands-on treatment to ordinary people. The role developed from the barber, who obviously would tend to basic grooming. They already worked with sharp tools and would hopefully have a steady hand. But the concept of the barber as a healer goes back even further than the medieval period, to around 3500 BCE. In ancient Egypt, barbers were highly respected and were often priests or healers. It was believed that evil spirits could enter a person through their hair, so having it cut would drive out these spirits. In the 3rd century BCE, the Romans had tonsors. These individuals operated shops specialising in shaving and hair cutting, and the tonsors could also perform minor medical tasks, so cleaning ears, trimming fingernails, and treating superficial wounds. The shops became a prominent place for social gatherings, and became part of a daily routine for wealthier citizens. By the medieval period, the practice of the barber surgeon was widespread throughout Europe. They primarily served as groomers, but their services extended to basic surgical procedures, so bloodletting, leeching, pulling teeth, treating wounds, and even performing amputations. Becoming a barber surgeon involved years of training under an experienced master. Aspiring practitioners typically began as apprentices, learning the craft by watching and assisting their mentors. Gradually, they developed hands-on skills in both barbering and surgical practices. The profession was also highly regulated, and barbers were expected to work within guilds. In England, they were officially organised under the Worshipful Company of Barber Surgeons, which was established in 1540. These guilds were essential for maintaining standards, supervising training, and coordinating apprenticeships. They also helped ensure that the barber surgeons adhered to ethical guidelines and preserved the profession's reputation. Their distinctive red and white barber pole is still used today, and its colours are said to represent blood and bandages, a reminder of their surgical past. Barber surgeons provided a much-needed service to the community. In many towns, they were far more accessible than university-trained doctors who focused mainly on diagnosing illness rather than treating it directly. Moreover, the barber surgeons were not tied to the Hippocratic Oath, which forbade the use of a knife. Despite their usefulness, barber surgeons were often seen as less prestigious than physicians. Physicians studied at universities and relied on classical texts, while barber surgeons learned through apprenticeships and hands-on experience. This divide sometimes led to tension between the two groups. Over time, however, surgery became more respected as scientific knowledge improved. By the 18th and 19th centuries, the role of barbers and surgeons were separated, and surgery developed into a formal, highly trained profession. In summary, barber surgeons played a crucial role in the evolution of medicine. Though their methods could be crude by modern standards, they provided essential care and helped lay the groundwork for modern surgical practice.